Good afternoon, everyone. We'll give it a few minutes so everybody can dial in. On screen, for those that are joining by webinar, hopefully you see the COVID-19 check-in on screen. And if you're joining us by phone, we'll walk through some of those steps as well. So looks like we already have about 35, 36 people so far. So we'll give it another minute. Good afternoon, everyone. My name is Jason, and I'm the Affiliate Services Coordinator for WASAC. I wanted to welcome everyone to the COVID-19 check-in today for Friday, April 17th. Before we get started, I want to go over a few housekeeping items with all of you. There's an option to raise your hand for those that are following along using the Zoom webinar. It's on your control panel. There's a hand icon, so if you wish to be unmuted, everyone automatically is muted on this webinar, so if you want to ask a question or make a comment, you'll want to raise your hand and we'll unmute you. Otherwise, if you're joining by phone and you're using that as your audio line, you can press *9 and that will alert us that you want to be unmuted. If you're following along by phone only, it's very important you press the *9, otherwise you won't be able to interact with us using the chat box or the question and answer box. If you want to type a question or make a comment to the panelists, you can use the chat box function, or we encourage you to use the question and answer box. Looks like I already have a hand raised. I'm going to go ahead and pass it off to Jamie to get us started.
Great, thanks, Jason, and feel free to click through the next slide. So we thank you for joining us for this Friday's check-in. Next slide. As you'll see, we are not doing any polling today. I know you are all really disappointed about that, but we felt that really not a whole lot of need to gather information from you all, and it's more of just a brief phone call. So thank you for joining us. I do want to remind you all, we sent an email out, I think it was yesterday morning, with a reminder for today's call, but also an invitation for Sunday's webinar. We were able to touch base with the governor's office as well as the Department of Health and dedicate a full hour, and I would bet a little bit over an hour, to do a situational update with Governor Inslee and Secretary Weissman around kind of their plans on reopening, some strategies around that, and the latest in terms of public health and epi data. So that is Sunday at 9 o'clock in the morning. I know it's an inconvenient time, but it was what we were able to get the governor and Secretary Weissman's availability. If you do need that information again, please email myself, Melanie, Eric, really any of the WASAC staff, and we will make sure that you have that information. You do have to register for that webinar. You can't just phone in, so registering early is important. So Just a reminder for that. Today, we're going to focus on a few things. I'm going to give you a brief public health update. I'm going to save the bulk of that for Sunday because I know Secretary Weisman has more information to share with you, so it'll be a quick and dirty update. And then Eric is going to talk about the CARES funding and give you an update on that. I believe Matt Chase from NACO is also joining us for today's call. And then we'll have a construction work group update as well. A lot of work has happened in the last week around that issue. And then if there's time remaining, we'll also try to get a chance to hear from you all to see if there's any other issues that we need elevating. Just a reminder, if you have a question or a comment, feel free to list that into the chat box, and we'll make sure that we read that out loud for folks to all hear. So with that, let's move to a public health update. So as you can see, can you go back one more slide, Jason? Thanks. As you can see, our case count is over 10,000. We have a number of counties that are over 1,000 cases themselves, and pretty much all counties impacted. I will say, although there hasn't been a positive case test received in Garfield County, we know that COVID is widespread across our state. One of the things that's really interesting to see is just how far and how many and how widespread it has been. I know testing capability and testing capacity has been an ongoing issue, but as we're able to do more and more testing, we're seeing more and more widespread community transmission. Next slide. So briefly, we've done over 128,000 tests in our state. I think that's really important to keep in mind that we're testing a lot. About 9% of those tests have come back positive. So we're about 9%. I'm not quite sure what percent we're really looking at before we can talk about reopening. That's something that I know Department of Health is going to touch on tomorrow, but roughly 9% of all of our tests are coming back positive. We also know that that's not necessarily uniform across the state, and that there still remains some kind of hot spots for positive tests. And then you can also see on the graph, and I apologize, it's a little bit small, but you can see kind of the cases and the deaths by age. So if you're looking at the slide, you know, the age groups 40 to really 80 years are the bulk of the positive cases, but the bulk of the deaths that are happening, well over 50% of the deaths that are happening are in the 80 plus population. So when we talk about vulnerable populations, you can see that age really impacts the severity of how you get COVID and the symptoms and the complications that come with that, which is why our elderly population is really vulnerable and remains vulnerable to COVID, although they're not necessarily anymore the bulk of cases that we're seeing, but they are the bulk of deaths that we're seeing. So I will, and then some burning questions. Go ahead and go to the next slide, thanks. So I know you are all thinking about, have we peaked? Like, have we reached the top of the curve? When are things going to be over? That's a common question I think that we ask ourselves multiple times a day. And then what's the plan to reopen? So I am going to reserve the last question and really let the governor and the Secretary of Health talk about that on Sunday. You've heard me talk about previously that it's going to be a dial, it's not going to be a switch. They're going to probably go into more detail of what that means, but it's going to be a slow process, and it's going to be very strategic and deliberate in how and where and what gets reopened and when that happens. I don't think there's a date in mind, but I think there's beginning to have a plan being developed. Have we peaked? I am confident that things are starting to level out in certain parts of our state. I think we can say that we're approaching peak. I want to be conservative and say that we haven't peaked yet, just because there are parts of our state that are still experiencing significant positive case results. And so I don't think it's fair to say that we've peaked across the state, because while that might be the case in one county, it's not necessarily the case in another county or another jurisdiction or another community. While we are seeing leveling out, particularly around the Puget Sound, we know that's not the case everywhere. And I think it's very important to reinforce that just because it's happening in a heavy metro area or in one part of our state, it's still not the case statewide. And we want to make sure that we support all of our efforts across the state. So that leaves me to when things are over. I don't think things are ever going to be quote unquote over, but I think we are starting to see, with this leveling out, an opportunity to start having conversations about how to slowly reopen or loosen a lot of those governor restrictions. So that is your quick public health update. Let's move on to the next slide, and I will turn it over then to Eric to do an intro and overview around CARES funding. I know you all have a lot of questions about this, so as Eric's talking and you have questions and comments, please put those into the chat box. And we have one coming in before I turn it over to you, Eric. Given we are now at a plateau, according to the governor yesterday, and we are seeing what are called rolling peaks in different regions, do you think the governor will take a regional approach or speak to the lowest risk response in statewide action? So I think what you're going to see is a conservative approach because there seems to be pockets of activity or pockets of outbreaks happening across our state. We want to make sure that we give those pockets all the resources they need to catch up with other parts of the state that are leveling out and plateauing. We absolutely don't want to roll back or loosen restrictions too quickly, because then we risk having spikes and increases in those pockets. I would anticipate that anything that happens right now from the state is going to be statewide, and the emphasis is really going to be making sure that our state is ready everywhere for statewide action. All right, Eric, I think we are ready to turn it over to you. And I believe Matt Chase from NACO is also on the call as well.
Yeah, Matt is on, so if we can probably get ready to open his mic up as well, that'd be great. Before I start, I want to say how good it is to see Walla Walla County Commissioner Jim Johnson's name in attendance. So Commissioner Johnson, welcome back and hope you are feeling well. It's wonderful to see your name in the attendee list. So that's great news. So thank you for joining us today. Let me go over what I'm going to chat about, and then we have invited Matt Chase, Executive Director for the National Association of Counties. He will have a chance to give you more of a national perspective, particularly what's happening with a potential additional COVID-19 relief fund dollars and the push that NACO is doing with the League of Cities and the Governors Association. So let me hit the highlights of what we have been working on. A number of you, I think, had a panic attack earlier this week when it was suggested potentially that that you needed to take action for those counties under 500,000 to be able to assure that you would be eligible for resources that were coming from the coronavirus relief fund. And that action that needed to be taken by today was only for our 4 counties above 500,000 people that are getting a direct apportionment from the U.S. Treasury. That's King, Pierce, Snohomish, and Spokane counties. The other counties have the potential to be eligible for resources that are coming through the state. And I just wanted to touch base a little bit about this. So you received a memo from me, or an email from me, I think Wednesday evening, I think it was, just outlining where we think we are and what we know. And let me first recognize how communicative and how open the governor's office, Office of Financial Management. We've been working closely with Scott Merriman on communicating with us about the potential for the fund distribution to cities and counties that are under 500,000. As I think you all know, the counties above 500,000 do get a specific amount of money. And I'll talk about that here in just a moment. And the rest of those counties and cities beneath the 500,000 will receive funding, hopefully receive funding through the state of Washington. At this point, we've been working very closely with the governor's office. They've given indication that it certainly is going to be money available for counties under 500,000. And let me hit the highlights associated with that. The state of Washington received nearly $3 billion. A minimum of that, or 55%, is guaranteed to go directly to the state, so 1.6 million. And up to 45%, or about 1.3 billion, is available to our Washington state local governments. Of that, and let me touch before I say of that, these are for COVID-related public health emergency costs associated between March 1st and December 30th. But we do not have really clear guidance on complete eligible of activities for reimbursement yet. And so we still expect that to be coming. We thought it would be yesterday or today. It may have come out, I just haven't seen it yet. But it's really for funds that were not accounted for in your approved budgets. And so we are looking for more guidance associated with that. Of that $1.3 billion that was provided to local governments, those 4 counties that I just spoke about $785 million is going to those 3 counties, those really 4 most populous counties in our state: King, Pierce, Snohomish, and Spokane. That still leaves about $542 million that could be available for the state to allocate to the maximum of 45% of the state's allocation. So that would mean that, again, $542 million would go to those 35 counties. And we have been talking with the governor's office, Office of Financial Management, conversations with Scott about what a formula and what potential formulas would look like, and how would we be able to get those resources out to counties beneath below 500,000. So I guess I really want to just say that it is something we have been talking with the Association of Washington Cities, trying to be collaborative on how we come up with an agreed upon type of formula. Working then ultimately with the governor's office and the Office of Financial Management, who really does have the final decision-making authority associated with these resources, but they've been very transparent and very open to having discussions with cities and counties about this. So we're pretty excited about and thankful for the great working relationship that we have had so far with the governor's office on this issue. We've had conversation with the cities, and we'll be continuing to work on that over the next week to 2. So that's a quick snapshot of where I think we are in relationship to the allocation of the coronavirus relief funds for counties under $500,000. I don't know if questions are coming in right now, but I think I would pause on any questions until we've actually had a chance to hear from Matt Chase with the National Association of Counties as well. So Matt, I think you are on the line. I don't know if your mic has been opened yet, but why don't we turn it over to you and see if you have any, if you can spend 10, 15 minutes with us.
Great. Thank you, Eric. Can you hear me?
Yes, perfect. Thank you.
Great. And this is not video, right? We're just doing audio?
Just audio.
Okay. Wasn't sure what I was supposed to do. Okay. Thank you to Eric, and thank you to Washington State Counties. I think Eric wanted to give me give you an update. Eric covered one of the more important programs, and that is the Coronavirus Relief Fund, or otherwise known as the State Stabilization Fund. We are incredibly disappointed that they did carve out the city population from a couple of counties, including King. And why they did that was actually to give the governors more money to control. And we can talk about that later at Q&A. Where we are at federally is Congress has passed and the president has signed 3 different packages so far. The first 2 were much more focused and smaller early on around research and development, funding for public health, some nutrition assistance for particularly kids who are out of school. And those really were the first two bills. And it's interesting, the first one was just, a couple little billion here and there. And then it moved to 100 billion. And then the third bill, the CARES Act, ended up over 2 trillion. The headline is 2 trillion, but just keep in mind that a lot of that are loans, loan guarantees, some tax credits. There are direct payments in there, but it's not necessarily 2 trillion in federal spend. Those loans will be paid back, and hopefully the small business loans actually are set up to be forgivable, but the ones for the airlines and the other bigger industries are to be paid back. 4 counties, we have focused since day one of this back in late January, early February on testing and PPE. We continue to try and put pressure on there for an aligned federal, state, local strategy, that you have this kind of going back and forth. Is the federal government in charge? No, they're not. Yes, they are. And what we've been saying is there is statute. The law says that the federal government is actually supposed to lead the way on the procurement during a disaster. That's why the governors were asking the federal government to take the lead. It's not that they couldn't do it. It was the federal statute actually dictates that. So we can talk about that later. For the CARES Act, we have put out a number of publications. I would encourage you to make sure you get the NACO memo that goes through each of the appropriated programs where there are dollars. What we did is we went through the basically 300 billion in federal appropriations, and we identified each funding stream, which ones are state formula based, which ones go to intermediaries like a metropolitan planning organization, an area-wide agency on aging, maybe a workforce investment board, maybe a community service action agency, or to cities and counties, including through your transit systems and your airports. And then we identified those programs that are nationally competitive. So for example, the U.S. Economic Development Administration, which actually has a regional office in Seattle that covers the western part of the country, they were given 1.5 billion to work with economic recovery. So if you were looking to develop an economic recovery strategy or a small business loan fund or even infrastructure, you could apply to EDA for a competitive grant. There is money under HUD with the Community Development Block Grant Program. They appropriated over $5 billion. $2 billion went out to traditional CDBG grantees, and HUD has $3 billion left at the federal level to come up with a new formula to distribute both competitively and as formula, including with the states. The big headliners are, as Eric said, the Treasury money that had 150 billion for states, and then those local units of government above 500,000. FEMA also has a total of 85 billion now for disaster relief aid. All counties are eligible for what's called public assistance and what's called Category B, where you can apply particularly for emergency related response. And I would encourage you to get the Category B list of those things that are eligible. It's on the NACO website, or if you look at FEMA, public assistance, and then type in Category B forms. A couple of other big things are, for the first time in our nation's history, the Federal Reserve has created a municipal liquidity facility to actually help states and cities, counties, and others that are having cash flow problems, particularly with short-term borrowing. The way they set it up is each state can actually go to the Federal Reserve for low interest or almost zero interest borrowing. And those cities and counties that are having cash flow can be bundled up through the state. There are a select few counties that can go directly to the Federal Reserve, and those are only counties above 2 million population. So there's only about 16 in the United States that can do that. I can come back to the CARES Act and talk about it, but what I would say is, please look at the NACO memo. It's 18 to 20 pages where we go through each funding source. What I would really encourage each county to do is focus on setting up your accounting system to track your COVID-19 expenses, as well as try and keep track of your lost revenue. That accounting is really, really important. Moving forward, Congress is working on a fourth package, and actually sitting here tonight trying to negotiate with the Senate and House leadership on a potential aid package for state and local governments. What happened was last Friday, the Senate Republicans brought a bill to the floor in very quick order that would provide additional $250 billion for small businesses. The small business pot of money that they put in the last bill has already been fully subscribed. And you were talking over 250 billion literally went out the door and committed within 10 days. Just to put the economic crisis in perspective, we now have 22 million unemployed Americans officially, and that number will continue to rise. During the 2008 crisis, we hit 15 million, and that took 18 months. So between 2008 and 2009, we ended up with unemployment of 15 million Americans. In just 4 weeks, we have already gotten to 22 million and growing at 4 to 5 million additional per week. So there is pressure to make more money available, particularly for small businesses. When the Senate Republicans brought the bill to the floor, the Democrats objected. They said they would support the small business aid, but they also wanted additional money for healthcare providers, including hospitals, public hospitals, and other healthcare providers. That would include counties where you have different healthcare services, or if you provide uncompensated care. They also asked for some changes to the election assistance money, including waiving the 20% match. They changed some of the timelines that would be required for elections, and they would expand some of the SNAP food nutrition benefits. Another big provision, or the big provision for us, is they would allocate an additional 150 billion for state and local governments, including for lost revenue. And it would essentially be like a revenue share from the federal government down to the states and the local governments. The states would get about 85 billion in total. There'd be about 11 billion for tribes and territories, and there would be 53.5 billion left for cities and counties. From a NACO perspective, the big fight is the HUD Community Development Block Grant formula would be used to calculate how they would divide the money between cities and counties. We have objected fairly strongly, very strongly, I should say, because cities would start with 52.3% of the money and counties would start with about 16%. And then there would be 30% left over for Congress to figure out how to divide between all the non-entitlement cities and counties. So under that scenario, the most that counties could get would be 33% and cities would get 67%. We are objecting, saying that one, when you look at the COVID-19 pandemic, it's actually counties who have the bulk of the cost. And nationally, counties own 1,000 hospitals. We run 1,900 local public health authorities, the jails, the emergency operations centers, the coroners, behavioral health, the list, you all know, it goes on and on and on about all your costs. And when you look at the lost revenue, depending on the county and depending on the state, we're losing as much revenue as the cities. They've created an impression that cities are much more reliant on sales tax than counties. When we look nationally, about 34% of county revenue comes from property taxes. The rest are different fees, sales tax, federal state aid. And so we're pretty hardcore that there should be a more equitable distribution. We realize there's a lot more cities than there are counties, but it needs to be a lot fairer than 67 to 33. What we are doing now, tonight, we're trying to negotiate a compromise. If the cities and the counties fight, more money will just be sent to the governors. And what we want is a win-win-win, where the governors get their money, cities get their money, and the counties get our share. Right now, the Senate Republicans in the White House don't want really any more money for state and local. They think we've gotten enough. The Senate Democrats are pushing hard for this. So if they're going to push for it, we want to support them. So what we are really focused on is making sure your members of Congress hear from you that this is important and that we need a little more equity. In the state of Washington, if they use the CDBG model, the state, not the state government, but the geography of the state of Washington would get $924 million. $924 million. Urban cities would get $442 million right off the top. So the city of Seattle, for example, would receive $151 million. So the city of Seattle would get $151 million. By comparison, King County would only get, not I say only, but only $89 million. That same scenario plays out where the cities tend to get more than the counties. So we're trying to correct that. The urban counties would get a total of $274 million, and then the balance of state for all cities and counties would share $206. Again, we just don't think that's an equitable way to do it. So we're trying to fix it. I think, Eric, why don't I stop there? Probably went too long anyways, and see if there's questions or if this is making sense to folks.
Great, thank you, Matt. If you have questions, maybe I'll throw it back to Jason or Jamie, but if you have questions for Matt, if you want to type them into the chat box, or if you raise your hand, I think Jason is monitoring and Jamie are monitoring people raising their hands, and we can put you on and unmic you or open it up for you. Are there any questions coming in, Jason or Jamie? I'm skimming right now.
Yeah, Eric, we have a couple in the Q&A box. We have one from Councilmember Stevens in San Juan. Is there a way to find out where SBA and PPP funds were distributed? I'm thinking this is a question to Matt around small business administration. He's been hearing in San Juan County that folks haven't received funds that they've applied for.
Yeah, great question and great point. There, I'm not 100% sure. I believe there are websites tracking that. I can follow up and follow back up. What is happening with the small business money is those larger small businesses that traditionally work through the banking system and work with Wells Fargo, JP Morgan, Citi, and some of the big banks that actually are administering these loans for the federal government. So those that are normally borrowing money from the banks were at the front of the line. So if you're out in San Juan Islands and you just have a small local bank that's not part of SBA's broader national network, then the chances of them tapping into that PPP, they were way at the back of the line. And what is happening is those small businesses, particularly those that are 25 employees and under, really have not fared well in this. And those small businesses that are kind of outside the traditional banking system and were running on credit cards and family loans and other non-traditional banking, they kind of got left out in this whole deal, which is why the White House, Senate Republicans, and, well, both parties in Congress are looking at more aid. So I'm not surprised, particularly in the more rural areas, that your small businesses probably are not faring as well as intended.
Great, thanks, Matt. We have another question from Commissioner Baker in Yakima County. Is there any discussion of grant funding to improve the technology in counties to keep staff and the public safe? For example, online payments, online permitting planning, teleconference capabilities, just as some examples.
Hey, Matt, this is Eric. Before you answer that, I think this is an area in talking with our county IT directors over the past month, and we were very thankful to have Rita Reynolds, your Chief Information Officer, join our IT directors this week on a call. That there's no question that one of our interesting expenses over the past 4 weeks has been investments in technology so that we could continue to deliver business throughout this period of time.
Yeah, great question. There is nothing directly, although going back to Eric's discussion earlier about the state's money on the Treasury, this Treasury program, I think that would be a tremendous use. The way that program was structured was you can't use it for lost revenue. You can only use it for new expenses that were not in your last adopted budget. So if your counties are spending a lot of money on new IT upgrades for those things like courts and recorders and assessors and other things that were not in your original budget, that would be a great use of that money, because that money is going to be kind of hard to spend the way it's structured. There's much more focus on finally tackling broadband in underserved areas where the FCC received money to try and bolster high-speed broadband access. But as far as more technology-friendly county government services, there's really not a huge appetite at the congressional level to make that a focus. But I think you could be creative using that Treasury money if you worked with the state to work on that.
Great, thanks, Matt. Eric, I have, I think, a question that's more for WASAC. Just making sure that NACO's CARES resource documents can get shared through WASAC to the members, and perhaps a way to put that link on our website so that it can be public facing as well.
Yeah, I actually do think we actually did send the major NACO document that I know NACO sent to, I think, every member as well, but we will make sure we post that on our COVID-19 resource document and make sure we get that back out.
Yeah, and to that person's question, I think as county governments and just as a country, we're really going to have to rethink and reimagine our service model. And we were already moving in many counties to more technology-driven interfaces for the public. But what we are struggling with at the national level, I think, is there's mounting pressure to reopen the economy, and rightfully so. And there's this tug of war between public health and business, really. And I think what the commissioner's question is a great one of, we're not going back to what we were. We need to think through a new normal, and technology will be an accelerator. It's gonna, you're seeing a lot of innovation occur during these safer at home. And I think counties are gonna have to really look at how do we evolve, because without going off on a rant, since 2008, cities and counties have lost 50,000 public health positions. The city and county local public health system has lost 25% of our workforce since 2008. And we are now feeling the impacts of that. What has happened is every time there is a outbreak, whether it was Ebola, Zika, H1N1, opiates, hepatitis C, AIDS, Congress keeps starving our general funding for public health and funds that crisis of the moment. And what we're really pushing them to do, and I think the state of Washington and WASAC, you guys have been doing this for 10 years, is you've been trying to rebuild the overall public health system, which is, I think, why the state of Washington ended up doing better, even though you got hit hard early. So without taking too much of your time, I do think it's something as a country we got to really think about, because this won't be the last virus and it won't be the last outbreak. So how can we use technology to prepare to be more resilient so that we can keep the economy moving along?
Matt, thank you for your time. I know it's this evening back there. I think you just made Jamie Bodden, who's our managing director of our public health affiliate. She's over there probably, pounding her fist saying right on for your last statement. We have worked very hard on our foundational public health services to try and build the capacity for us to deliver a complete public health system throughout the state of Washington. Whether you're Garfield County with 2,200 people or King County with 2.2 million, every citizen would have equal access to a strong public health system. So
well, she's a rock star.
We're not there yet.
Yeah, she's a rock star. She spoke on our Western region call the other day, and they said people wouldn't hang up. They were just enthralled. Yeah. So congratulations.
Yep. Great, thank you. Any other last minute questions for Matt? Otherwise, we'll move on, I think, to our construction update.
Okay. Thank
Matt,
you all.
thank you. Yeah, thank you very much.
Great weekend. Thank you.
I'm not seeing any other questions. So if Jane and Paul are on the line, they have been representing WASAC and our engineers and our county planners in this work group. And a lot has happened in the last week around construction planning and proposals with our construction work group. And I know you all have been anxious to hear that update as well. So I will turn it over to Jane and to Paul to give an update on what's been happening.
Thank you, Jamie. Can you all hear me okay?
Yep, you sound great, Jane.
Excellent. So I'm going to kick it off, and then Paul will follow up with what I left out. But as most of you are probably well aware, the governor's office has convened a stakeholder group to talk about restarting construction work in the state of Washington. And this was based on pressure that he was receiving from the construction and labor community when the stay home, stay healthy order was initiated weeks ago. And since that time, or early on, Paul and my understanding was that the construction community, the management and labor were in conversations with one another on how to make sure how to get back to the work site and how to ensure that employees and workers were safe at that work site. And then this stakeholder group was convened, I think just 2, maybe 3 weeks ago. So we've had a series of 4 or 5 webinar-based meetings since that time. Before the first meeting initiated, local governments were made well aware, just based on the rhetoric that was shared in that first meeting, that clearly these conversations had been happening behind the scenes for a while, and we had a lot of catching up to do. And it was not until, let's see, today is Friday, so it was not until I think Tuesday of this week that we were actually given any sort of paper in front of us to be able to see exactly what type of work and conversations have transpired over these first number of weeks. And in fact, it was a very, I would say, in-depth, lengthy document, around 4 pages, around, I think they titled it Phase 1 construction, kind of the first phase of getting people back onto the work sites, and the criteria and stipulations that would need to be met by the construction site in order to ensure that workers, employees were safe. However, there was no consultation with local governments, and my understanding, little to no consultation with agencies like DOT. I do think that there had been some conversations with agencies like the Department of Health, maybe LNI, I'm not sure, but where what our perception from the local government and county standpoint, what's really missing there is an acknowledgement that local governments are a part of this, need to be a part of this conversation and solution, and that we bear a significant burden and responsibility when construction does get back up and running. However, we also don't want to be seen as an impediment or a roadblock to getting people back to work in a safe and efficient manner. So we were afforded an opportunity yesterday, Thursday, to share with the group our concerns and feedback. That was the first time that we were given that opportunity. And primarily where we are coming from is that any sort of responsibility around regulations, regulating PPE, regulating social distancing, any added inspection responsibilities really should go to the Department of Labor and Industries, that counties at this point are stretched thin, and that we just, individual county by individual county is going to have to be able to make the call about whether they are able to add any sort of increased workload. And frankly, it is our perspective that there should be no assumption that counties bear any additional burden than what would already be a common responsibility under just the status quo or current working conditions. So we are in the process of developing a memo alongside the Association of Cities that we will submit jointly to the governor's office, hopefully by Monday, early Monday, that outlines what our primary concerns are. And so again, that is ensuring that the Department of Labor and Industries is really the explicit agency that bears the responsibility around enforcement of workplace standards, that there is an acknowledgement that local governments have faced that we are facing at this point pretty critical responsibilities in other areas, and that at times some of our workforce has either been asked to focus their attention elsewhere, has been asked to work from home, or frankly, there are some employees that are not working at all right now, and that anyone needs to be understanding, and there needs to be an acknowledgement that we may not be as nimble as we were before, and may not be able to respond as promptly as maybe a work site would like us to be doing in this time. And so we would really appreciate an acknowledgement like that. We also would ask for an acknowledgement that we are probably going to be facing some pretty significant declines in revenues, and again with workforce limitations, and so that this could inhibit our ability to be as nimble as we'd like to be and responsive. And then finally, I would just note that we're asking for some sort of immunity, some sort of an immunity from liability in terms of processing construction-related permits if a safety issue comes up, or if an incident comes up, that we ensure that local governments don't incur any additional liability than what wouldn't have been incurred before, right? Certainly we're not asking for any sort of exception to whatever the status quo or norm is, but in these extraordinary times that we're not bearing any sort of additional liability if someone were to get sick on site or anything like that, that local governments would not be responsible, for that. So I think that's what I wanted to cover. Paul, I'm not sure if you have additional information to provide. I will note that Paul especially has been incredibly engaged with county planners and other various county level officials and staff members that work day in and day out on these issues. And so I think he has had a lot of really good feedback from his people. I have also been engaged with the county engineers and to a lesser extent public works directors. They've been a little more mum and quiet on the issue, but Paul has been just a rock star with his group and being able to solicit really helpful feedback.
Thanks, Jane. I appreciate that. I do have a couple of things to add. Just building on your final comments, not me being a rock star, but just your comments about being engaged with planners and others. I just wanted the commissioners to know that we have been conducting regular meetings with your planning and building departments, if you didn't know that already. And they have been very, very engaged on this issue. We met with them about this item on Wednesday afternoon. We had over 43 or 44 different folks attending. So if you want to know more details on a local level and how they are already anticipating how this may impact their operations or their ability to meet the demands of a reopening of the construction industry, I'm sure that they can certainly engage with you on that topic. I wanted to mention that what we're really anticipating here and what we've seen so far is 3 different phases, and we've only seen phase 1. We know that because they're talking about it in phases, and if you've seen the document for the proposal, it says phase 1 construction restart, and I think it calls it low risk. And they define low risk as activities that can be performed on a construction job site that minimize close interaction between employees and can adhere to social distancing standards. So that's really their definition on that. We have not seen a proposal on phase 2, and we have not seen a proposal on phase 3. And if it follows the same pattern, we can only assume that phase 2 would be kind of medium risk types of activities, and phase 3 would be higher risk or high risk type of activities. Unfortunately, this entire process has been somewhat unpredictable as far as how it's going to roll out and what the timing is. And we've been listening really closely for any timing cues, and we've been asking those questions, and we just haven't been getting them. And Jane and I have been talking about this quite a bit, and we've been engaging with folks over at the Association of Washington Cities as well, and they agree with that. We were frankly pretty surprised to see the phase 1 agreement on Tuesday because we had received no advance notice of it being discussed whatsoever. So we don't really know when that agreement may go before the governor and when the governor may take action, other than the fact that people are pushing on it, and we have no idea at this point about phase 2 or phase 3. So it could happen very quickly, or it could take a little bit of time. I just want to add too that the key messaging that Jane was talking about is really focused on maintaining flexibility for local programs and maintaining your ability to make decisions on your business models moving forward, considering your local circumstances. We have members, obviously, like King County, with lots of people in their building and planning departments, several inspectors, lots of permit writers, lots of plan examiners, all the way down to Lincoln County or Ferry County, where it's one guy who issues all the permits, does all the inspections, and does all the plan reviews. And so that's obviously quite a disparity in service level capabilities. And we know that if Ferry County loses their one person, or Lincoln County loses their one person, that's quite a different impact than if King County maybe even loses 5. And so we want to make sure that you guys have the flexibility to not just write policy based on changing conditions and amend those as necessary, but also enforce them. And that's really what we're looking at. If you have other ideas on how we should be approaching this, or you have other input for us, please let us know. Both Jane and I are really engaged in this process. And even though Jane said some of our members have been a little quiet on it, there were folks from the County Engineers Association in the form of public works directors who have attended a couple of the meetings with the planning group to hear about these issues and to provide input. So they are engaged at some level. And then we've also been talking with environmental health through Jamie and getting input from those folks as well. And I think that's the only thing I wanted to add.
Great, thanks Jane and Paul, much appreciated. And I know the commissioners were very excited to hear the update. I haven't seen any questions come through. So you either did a very thorough job or you've just dazzled them into silence. So I think rock stars all the way around.
Jamie, there's one question in the question box.
Oop. So there is. So this is one from Commissioner Baker in Yakima. Have there been stakeholder work groups with any other shutdown industries? Many of them have proposed safety plans. Some examples, salons, car dealers, etc. I'll just answer from the public health perspective first. We have had very initial discussions with the Hospitality Association on how to safely reopen not only our food establishments, but also thinking about transient accommodations like hotel, motel. Very early days, but are kind of figuring out how that a work group might be formed and work through that process. I have not heard about any other work groups around other industries, particularly like manufacturing or office or things like that. I think that would be a great question to save for Sunday and pose to the governor and encourage more work groups if that seems to be an effective strategy. Another question from Commissioner Price Johnson. Do you expect the governor to roll out his phase 1 plan on Sunday's call? I would expect him to, I don't know if he will roll it out, but I think he will absolutely hit on it. And I think he will probably outline some of the criteria that they're looking at from the state level, as well as some of the benchmarks that will help us determine when we've met those criteria, and then probably touch on what those first rollbacks or dial backs or easing on the restrictions, however you call it, might occur. I don't know if they're going to, do an official rollout of phase 1, just because I don't know if they feel like we're at that point yet or not. But I do expect him to touch on it in some way, and there will be time for question and answers on Sunday as well. So if you feel like he hasn't answered your burning questions that you have for him, there will be a chance to prod him a little bit more as well. All right, I don't see any other things coming in. Next slide, Jason. So again, a reminder, for next week, we have Vice Admiral Bono, who is working with the healthcare response, working very closely with our hospitals, our medical providers, the healthcare authority. She is coming to do a brief presentation next Friday. So please come and attend. I think it'll be very informative as we talk more about testing and kind of what has happened with our healthcare system and how our healthcare system has responded to this outbreak. Still open to hear from other guest speakers. So if you think of folks that you would like to hear from, or departments or areas that you'd like to hear from, please let me know, and we will continue to reach out to them and get them on our calendar. Reminder of the webinar on Sunday. Again, if you need that information, please contact Lynn, Melanie, Eric, anybody from WASAC to help facilitate that. We have a question, who is chasing the cows on a bike? That is in response from last week from our keeping a safe distance so that you keep 2 cows lengths from people. So that's kind of an inside joke that we've been sharing around WASAC. Are there any pressing issues that, or big issues that have come up for you all in the last week that you feel like we need to touch on that we can work on next week for you? Should be two Tiger, like somebody says. Somebody is a Tiger King fan, I think.
Jamie, there's two questions in the question and answer box. So, you know.
Thanks, Jason. Is there any talk of extending the stay home order? I haven't heard of any talk of that. I have heard of instead modifications to social distancing for a very long, prolonged period of time. So while it might not be stay home, stay healthy, what it might look like is different social distancing practices for the long term. Slides for this session, we can send them out again. We sent them out earlier, but we'll absolutely send them out again to everybody. And I know the recordings get posted a couple of days as well online for folks to reference as well. I haven't seen any other questions come in or any other comments about big issues that have been going on. So I don't know if that's a good thing or a bad thing, or if you are all saving your burning questions for Sunday to pose to the governor. But I don't have anything further to discuss. Eric, I'm not sure if you have anything in addition.
No, I don't. Yeah, please feel free to contact any of us that spoke today if you have more specific questions, either via email or give us a call. Happy to talk to you. I would just continue to remind you that we are spending a lot of time with your departments in regards to how they are responding to COVID-19, doing their business during this period of time, seeing a lot of communication amongst our departments. So that has been very, very encouraging, and your WASEC staff is spending a lot of time with them.
Great, thanks, Eric. And we did get a suggestion from Commissioner Gelder to see if Speaker Jenkins would, or Senator Rolfes, to talk about a special session and budget. So those are two that I think would be very interesting to hear from, and we will certainly extend those invitations to see if some of our state legislatures can attend and speak. So with that, thank you all for attending. We've almost ended on time this week, and I wish you all a very happy and safe weekend, and talk to you all on Sunday.
Thanks, Jamie.
Thanks.